We focus on HCC caused by MASH, Metabolic-Associated Steatohepatitis, which is growing in its incidence, especially in the US and Western Europe. I described some very recent results that were published at the very beginning of this year. And what we have shown is that the diet, the MASH-inducing diets, especially diets rich in fructose, actually cause DNA damage to the hepatocytes, and the hepatocytes, in response to DNA damage, undergo senescence. And we work with mouse models, but we can see that livers from MASH patients contain quite a few senescent hepatocytes, and the senescent hepatocytes show signs of the DNA damage response. So it looks like it applies also to people. It's been described in one paper that the senescent cells make PD-L1, and thereby they suppress elimination by immune surveillance. However, we described quite a few years ago that yes, immune surveillance is very important for protecting us from liver cancer, but the production of PD-L1 is not localized to the hepatocytes. It's actually localized to IgA-producing plasma cells. They retain very high levels of PD-L1 expression, and when we get rid of these cells, we actually achieve tumor rejection. Except some tumors that are surrounded by a dense fibrotic envelope don't respond very well to this therapy or PD-1 blockade, and we found a way to make them more sensitive using a very common, very cheap antihypertensive drug called losartan, which by engaging angiotensin II receptor blocks TGF-beta signaling. Okay, and then we looked at the state of macrophages in the liver during MASH development at the precancerous stage. So I've been working on inflammation for years, and that's part of the reason I'm interested in HCC, because it's an inflammation-driven cancer. And I always thought, okay, we only have inflammatory macrophages in the liver. But now with single-cell sequencing, single-nucleus sequencing, people have described many varieties of macrophages in the liver, up to 9 different ones. And a few years ago, several groups identified what they called lipid-associated macrophages, and some groups assigned them with protective activity. Some groups say they are pathogenic, others say they are immunosuppressive. And even if you accept that they are protective, they are really not that protective, because you find them only in diseased livers. So in humans, they are quite abundant in people with liver cirrhosis, so they have not protected them from liver cirrhosis. So by re-examining published data, we found that actually there are 2 subsets of LAM instead of one, LAM1 and LAM2. And we identified the LAM2 as having more protective properties than the LAM1, and that may explain the controversy. And trying to identify transcription factors that differentiate between LAM1 and LAM2. We found that the LAM2 show the signature of a transcription factor called NRF2, originally identified as the master regulator of the antioxidant response, but we know that NRF2 is a general regulator of metabolism. And to see if that's really what's important, we generated mice in which we express an activated form of NRF2 in the myeloid lineage, and curiously, it only has effect on the LAM2 subsets. It expands it, and these cells, and even before they go into the liver, when we get them straight out of the bone marrow, as long as NRF2 is activated, have incredible capacity to just mop up the lipids and burn them. So they protect the hepatocytes from lipid accumulation. They also mop up all the debris, all the remnants of dead hepatocytes. And by doing that, they suppress the inflammation that can lead to cancer. They suppress the occurrence of liver fibrosis. And we have shown that indeed mice in which we activated NRF2 in the myeloid cells develop fewer tumors, and the overall tumor volume is much lower. And that's in complete contrast to what NRF2 is doing in the hepatocytes. And in the hepatocytes, we have shown that it gets them out of senescence, so they can rapidly progress into cancer.